Goeienaand, dis 7:00 en dit beteken dis tyd vir Fokus hier op SABC 2. Baie welkom, ek is Lenet Francis Puren. Meer as 20.000 mense het nou reeds in Suid-Afrika gesterf aan die coronavirus. Verlede week het president Cyril Ramaphosa Suid-Afrikaners gevra om steeds te voldoen aan die bepalinge van vlak 1 van die inperking, want die getal nuwe gevalle het weer begin toeneem. In die buiteland het talle lande hulle inperkingsmaatreëls verskerp te midde van 'n skerp toename in COVID-19. Maar wat beteken dit vir Suid-Afrika, veral in die lig van die komende Kersvakansie en met die grense wat nou weer opgestel is vir buitelandse toeriste? Ons praat via Zoom met professor Adrian Puren van die Nasionale Instituut vir Oordraagbare Siektes. And thank you so much for joining us this evening. When you look at the numbers and you see a resurgence, particularly in South Africa and abroad, what are the scientific questions that come up for you, the alarm bells that ring when you look at the numbers?
So, Lynette, thank you very much for the opportunity. So, when we looked at events in Europe and in the United States, for example, during the summer months, we had noted that transmission of this particular virus had actually continued, and there were certainly declines in the various countries, but as they went into their summer months, actually relaxed their particular restrictions, we actually did notice an increase in the numbers, by which time we had reached our particular peak, and it certainly were declines in the numbers. We're approaching summer, and there's ongoing transmission. I know some of the countries have certainly tried, when you look at the UK and in part the United States, certainly tried to control or have restrictions or lockdowns, but that actually has not been successful. So I think these are the sort of warning signs for South Africa as well. There's ongoing transmission, hospitalizations, and deaths. So all those key things that we have been talking about through the lockdown and after the lockdowns till now lockdown level 1, I'm afraid still remain in terms of what we need to do to try and really minimize transmission in South Africa and prevent what we're actually currently seeing in Europe and for example, the United States and the UK.
What would you ascribe the difference in approach to compared to South Africa and Europe, for example? You've referenced the United States. What has been the inconsistencies that has led and created the environment for a spike like we've seen in the United States, for example?
Yeah, so the United States is a more complex country than, let's say, Europe or some of the countries in Europe. So I think we really are trying to learn. And it's not that these countries are not necessarily knowing what to do. I think it's really that there are many challenges as to how to manage this particular pandemic. However, there are certain things, for example, levels of testing, communication around, for example, the wearing of masks, physical distancing, the opening of universities and schools. These have all contributed to, I think, actually seeing what we have seen in, for example, the United States and in part in the United Kingdom as well. So, for example, policy decisions around whether or not there should be partial lockdowns or full lockdowns, and communicating these two communities that have really struggled through their harsh winter and then their summer, I think it really has made it very difficult. So that whole coming together of these complex ways of managing the pandemic and our various communities have really made it difficult to control. And these are the things I think we need to learn.
Yes.
Because we have already seen, you've seen in the Eastern Cape and in part in the Western Cape, we've certainly seen an increase in the numbers. I know the technical terms could be resurgence or spikes or outbreaks. But again, we need to focus on what is it in those particular communities, because again, I don't think it's one size fits all to be a bit mundane on that point. But I think we need to really look and understand what's happening in those communities and how best to ensure that the messages that we've been talking about over these last few months still remain in order for us to try and reduce the transmissions that we have seen. Because I know that there has been improvements in terms of managing patients at hospital levels. However, it's still critical that we don't overburden and overwhelm our hospitals, for example. So those key messages still remain, I'm afraid. The physical distancing, the wearing of masks, the hand hygiene, these are still very important.
Within your organization, if you look at the Western Cape and you look at the Eastern Cape, why and what do you attribute that rise in cases and infections to?
I think it's difficult to give an immediate answer. There may be various complex answers, but I suspect it goes back to when we actually started with the lockdown. It was a very harsh lockdown because that was what was required at the time in order to try and really ensure that the virus was not transmitted. But as you know, the virus continued to transmit, and in fact, we then had those peaks in July and August. And I think it's really because communities have found it really difficult, or some communities at least, have found it very difficult to actually ensure that the ideas or the advice around physical distancing, the wearing of masks, are adhered to. So I think there have been some attempts, but it's really difficult because when you look at what we call the R0 or the effective R, and the effective R refers to the level of infection that's being transmitted in our communities, we never reached 1 or below 1. It was only really later on in August and part of August and September that we really saw that this value of the effective R was below 1. In fact, that transmission was actually slowing down. And in fact, there is still some evidence in the other provinces that transmission is slowing down. But it's really been really difficult to sustain that. And I think that's what I'm trying to say is that we need to come back and really try and reinforce these messages. Just because we are at level 1 doesn't mean the virus has disappeared. And as you know, on the contrary, we're seeing the effects of our inability to adhere to these non-pharmaceutical interventions is what we're seeing in the Eastern Cape and the Western Cape. There may be multiple reasons, and therefore I said it's not just a matter of saying, well, now we're going to have another lockdown. I think we really need to understand and see how we can best communicate those key messages in order to try and limit transmission.
So, Professor, when we see the amount of cases in Europe and in particularly in the United States, and now we've opened our international borders for tourists to come from there to South Africa, how wise is that decision? Is it enough to just say, well, you've got to have a clearance certificate saying that you're clean, you're not infected, you weren't in contact with anybody else? Is that really enough to protect South African citizens from those coming from abroad, where there are spikes?
Yeah, so I think there's always risk. So this is a risk adjustment approach. I think that the introduction of, for example, knowing that particular person's status prior to entry, I think is in some ways a helpful step. I know that the Department of Health is also considering with the ports authorities around testing individuals as they present by using, for example, so-called antigen tests. So I think there are these particular steps, but that may not be the major source, I think, of infections. I think the major sources of infections will be within our communities in terms of the spikes and the surges that we have currently seen. As you know, when we started off the outbreak started off in South Africa, we certainly made some attempts, and we in fact did change that curve in part, and those were the travelers that came in. But then it went beyond the travelers. And I think it comes back to the fact that what can we do within our communities, in our society to try and limit that? So I think travelers are a risk, but they're not the major risk, given the levels of transmission that we're currently seeing.
So after the break, I'd like us to focus upon what our approach will be in the Western Cape and in the Eastern Cape. And I know you said there isn't a one size fits all. So ons gaan daaroor gesels net na die breek. Daar is nog baie vrae. Bly ingeskakel. Welkom terug. Ons praat vanaand oor die toename in nuwe gevalle van die coronavirus in Suid-Afrika. Met die vakansie om die draai, wat beteken dit vir Suid-Afrika? Ons praat via Zoom met die Nasionale Instituut vir Oordraagbare Siektes, se Professor Adrian Puren. Professor, you mentioned that there aren't any clear-cut answers and its complexities with regards to the Western Cape and the Eastern Cape. Do you foresee a time where we will probably have different levels of lockdown depending on what the amount of infections are in the various provinces?
Yes, I think we will, maybe we won't really use the word lockdowns, but perhaps we will certainly look at, for example, certain restrictions, for example. So we'll not go back to level 5. I think there was an acceptance that was the blunt tool that we could use at the time. I think we now really need to say, well, in the absence of full lockdowns like level 5, for example, what are our options and how do we best approach it? Because again, I think we need to accept that the lockdown, as we experienced not only in South Africa but worldwide, had certain effects in terms of the psychological effects, the effects on the economy, for example. These are the clear effects, and on our health systems as well. And this lockdown was really not going to work at all. So I think the approach is really to try and understand what approaches could we use within communities to try and ensure that there are levels of compliance. In other words, we have to look at some of the activities. So we've certainly stopped mass attendance activities, but again, do we really need to look clearly at those particular small level activities and try and see how we can actually control those, for example, in other words, or limit those numbers, because it's all about the exposures and contact. So how do we set that up? Again, alcohol bans, I think alcohol certainly has played a role. It's affecting, again, not only our communities in terms of hospitalizations, but again, if we introduce the bans, what are the perverse effects that will have? But so how do we control that? So those are the types, I think, of questions we need to ask. Our communications with our community, again, I think it's really important that it be engaged at a local level. Provinces need to manage and are managing their epidemics, but even at that district or sub-district level, how do we actually engage with communities to try and get them to understand the messages? I know it is wearing to wear a mask, but that's one of the important things. I know when we started off, we said, masks, who wants to wear masks?
Yes.
But now that's seen as a really critical part of our non-pharmaceutical interventions. So how do we make sure that people adhere to that? The physical distancing as well. We talk about 1 meter or 2 meters. It may not always be feasible, but how do we manage that?
I was wondering if you've got a sense of, because I certainly have seen it, that South Africans are suffering in some sort of way from corona fatigue.
Yes, I'm not sure we should use the word fatigue, but yes, it is. How do we inculcate that into our culture, if you like? The wearing of masks, the physical distancing, the social events not happening and occurring. I think it's really around a change in our mindset as well. As you know, in Asia and other countries, the wearing of masks and so forth was really routine, if you like. Yes. It really became part of their societies. So again, how do we make that part of our society as well? So I think it's really understanding those particular approaches, I think, because a vaccine is a way off for us at this point. I know it's exciting to see the advances. We talk about herd immunity and reaching that. The levels of transmission in our country is not going to lead us to herd immunity. So I'm afraid the non-pharmaceutical interventions are with us for a while.
You touched on the vaccine now, 2 possibilities and positive information with regarding to that. What do you take from that? Are we going to just sit and wait? Are we participating? Are we waiting for Germany to say, well, let's move around some deals here, make this possible? Where are we at in terms of trials and the news now of these 2 possibilities of vaccines that will be on the market if everything is cleared?
Yeah, so I think it's very exciting that, within a space of less than a year, we have at least 2 vaccines that have gone through phase 3 trials successfully. Of course, we wait to see the scientific evidence. These have been publicity notes, if you like, about their successes. But I think it really bodes well, because various other vaccines that may have a different approach use certainly the same, what we call the spike protein, to induce an immune response. So if it is effective in those 2 vaccines, and those were really novel vaccines, then I think it bodes well for the other vaccines. However, as you know, there is a process for licensure, and this can take a while. I know that people think that it may take just a few months, but let's hope it does happen for at least those countries that have access to it. But I think on the other hand, South Africa is participating in vaccine trials, so that in a way does give us some advantage that we've participated in trials, and hopefully that allows us for access to those vaccines. But you're right, The competition, we thought that when we listened to the WHO that it's going to be an equitable distribution and so forth, but I think obviously there are challenges. If you look at people or countries that have actually ordered their pre-filled vials of vaccine, it's quite extraordinary to see, and therefore Africa is low down, and so you can just imagine where South Africa is as well. So it's really about the advocacy, about participating in these vaccine trials that I hope will allow us at caucusing, that will allow us to have access to these vaccines as well.
Thank you so much for your time this evening, Professor Puren. It's a good place to end this conversation with some hope that the change will come. Thanks again for your availability. Bly ingeskakel, net hierna besoek ons Groot Marico om in jou 'n interessante projek bekend te stel. Ons is nou terug. Die Learning Man inisiatief lok jaarliks duisende gemeenskaps- en omgewingsaktiviste. Dis 'n byeenkoms waar mense die geleentheid gebied word om jou vaardighede met ander te deel en vry in die natuur te leef. So 'n byeenkoms is onlangs in Groot Marico in Noordwes gehou en Adel van die Kerk het daar gaan inloer.
Hier is 'n baie groot diversiteit van mense wat hierso bly. Ons het 'n plaasgemeenskap wat meer die onder by Skynstrif se wêreld is. En dan hierdie gedeelte wat genoem word die Bankeveld. So dis eintlik van die Hoëveld af en dan kry jy die Bankeveld en kry jy die Bosveld onder. So hier onder by Skynstrif is dit nou die Bosveld. Nou daar's baie kommersiële boere. En dan die Bankeveld gedeelte wat 'n vreeslik berge en so aan is, soos wat jy seker al gesien het. En so dis 'n bietjie moeilik om trekkers hierso te werk. So hierdie gedeelte is maar meer vee en dan wildsplaas. Hier's baie wildsplaas.
Ek het Steven ontmoet en hy het gehoor van Learning Man via was baie excited om te gaan en toe hy teruggekom het van Learning Man in die Kaap het hy gesê ons moet so iets in Groot Marico doen. Learning Man as 'n konsep is nou ek dink 5 jaar of 6 jaar aan die gang. Hulle het begin in die Kaap en die konsep is gebaseer op 'n Amerikaanse konsep van Burning Man in Amerika in Black Rock in Nevada. So die konsep is al langer aan die gang, maar dis nou ons derde Learning Man in Groot Marico. Dit is radical inclusion, radical self-reliance, dit is decommodification en gifting. So dis alles konsepte wat kyk na 'n alternatiewe manier van leef, alternatiewe manier van community bou. So dit is maar waar Learning Man op gebaseer is. An economy without money, an economy with exchange. Dit is eintlik waarop dit gebaseer is. So Learning Man is ook bietjie meer off-grid living. Dit is bietjie meer closer to nature. Dit is bietjie permaculture, dit is bietjie barter en dit is al die konsepte wat eintlik al verwyder is uit ons kapitalistiese ekonomie. So it's just back to a different type of interacting in community.
Ons het net die woord uitgesit dat ons mense soek om demonstrasies te kom doen. Bring wat jy kan offer.
So many years ago I was involved in Freemasonry.
Maar die sprekers is maar meestal van die distrik hierso gewees. En alhoewel ons 'n spreker gehad het van ek dink is Johannesburg wat vir ons kom wys het hoe om mead te maak. Maar die meeste van die sprekers was uit die kontry uit gewees.
Enigiemand wat 'n kennis of 'n talent het wat hy wil deel, is welkom. Dis hoekom ons so verskillende soorte praatjies gehad het. Hey. Right. Rinse your hands, take your gloves off and I'll put a label on for you. Well done. By Learning Man is daar dalk ander balans van kreatiwiteit. So dit hang regtig af van wat jou community het en wat hulle wil bydra. As daar iemand is wat astrologie of astronomie doen en hy's passievol daaroor en hy wil gesels daaroor, dan kan hy ons kom leer.
The more you move and run around, the more nervous the snake is going to get. She's not that nervous, she's regurgitating.
Ons wil eintlik van alles leer. Weet ons skoolstelsel is baie nou en is baie akademies op 'n manier en dis so baie dinge wat nie geleer word nie. So dit is maar die konsep van Learning Man, broad learning en interesse kweek in ander mense se interest ook.
In hierdie hele stelsel wat die water nou al 1, 2, 3, die 4de keer gebruik word, het ons nou waterkastuiings en dis die eerste plek waar die waar jy jou eerste bron van kos op jou perseel. En jy die waterkastanje permaculture, ek moet sê permakultuur is 'n konsep wat gestig is deur Bill Mollison. So hierso in die begin van 70's. Hy het gaan kyk hoe die ou mense reggekom om, jy weet, kos te voorsien en so aan. In Indië het dit goed pos gevat, in Indonesië en natuurlik in Australië waar hy vandaan kom.
And eventually end up in zone 5, which is a wild zone, which speaks to the biodiversity in any permaculture design.
Now, there's another thing that's very important.
Ek gaan vir jou sê wat my eie ondervinding was nou gedurende COVID, nê. Kos word nie goedkoper nie. Kos word duurder. So, almal voel dit in ons sakke. En in hierdie manier van lewe, jy eet gesonde kos, vars gesonde kos wat nie deur 'n food chain gegaan het wat oral geld opgetel het en dan geweldig duur geword het nie.
Maar daar's baie mense wat 'n bietjie kritiek lewer wat sê dit is 'n baie niche ding, eintlik net mense wat dit kan bekostig. Jy weet, dis al mense wat jy kan bykom, maar die konsep self kan so mooi uitgebrei word en dit kan so waardevol wees vir mense presies wat nie resources het nie. So ek dink dis hoekom ons in al die provinsies eintlik wil begin. Dat ons daai mense ook kan bykom en dat ons daai radical inclusivity meer op begin fokus. Daar is opsies om dit in al die provinsies te doen en ons wil dit eintlik uitbrei na alle provinsies dat dit accessible word vir almal. Dis een van die punte van Learning Man.
Rotate and exhale and press towards the other side.
Ons wil hierdie ding moet uitbrei.
And the name of this python is Southern African python.
Dis nie 'n winsgewende ding nie. Dit is 'n learning man. Die Kaap praat nou al klaar van 'n learning clan. Maar dis 'n plek waar mense bymekaar kan kom. Jy bring 'n talent wat jy het, wat jy oor passievol is en jy kom deel dit met ander.
As dit 'n mannetjie, as hy net te wys.
So die hele learning man ding is bring what you can teach and take what you can learn.
Interessante ontvlugting. Dis ongelukkig al vir vanaand. Onthou Fokus word elke donderdagoggend om 10:30 op SABC 2 herhaal. En ons is ook steeds beskikbaar op YouTube. Indien jy met ons kontak wil maak, besoek ons Facebookblad of stuur vir ons 'n e-pos. Ons lees graag jou kommentaar, jou tweets en jou voorstelle. Jy kan dit vir ons stuur aan fokus@sabc.co.za. Bly op hoogte van al ons stories op ons Fokusblad op Facebook by Fokus SABC en volg ons ook op Twitter by Fokus ZA. Baie dankie vir die terugvoer en dankie vir die saamkyk. Totsiens tot volgende week.